Right here with me in the studio is the chairman for Stop TB Partnership Ghana, David Kwesi Afreh, who has been advocating for the government to put TB on high political agenda, since children especially are at high risk of contracting tuberculosis. David, thank you very much for joining me this evening. So let me take off from probably where the minister has given assurances that, look, we're working in earnest. But, I mean, you've been with me in this country for so many years. You knew the supply chain of vaccines, especially that of TB. What do you think is happening now? What has gone wrong?
Thank you so much, and good evening to our viewers. It is important for us to put some of these things into context. In Ghana, if you are closer to the actors, our duty bearers, the ministers and district chief executives, or even at the lowest level of ministries, you will realize that they are faced with a lot of systemic challenges, and so many things are boggling their minds that they are not able to really focus on the issues that matter in this country. It's sometimes mind-boggling on what sometimes the challenges are. The truth is sometimes the bureaucracies in the system are so serious that where I am coming from, it will surprise you to know that we were supposed to procure some tablets under the Ghana Health Service for health system strengthening, to talk about data quality, responsiveness in data supply from the field to the central base. Since 2001 till today, the process has not been able to get successful. 2001 to 2023.
As we speak, some 22 years back or something.
No, I'm talking about starting last year.
Okay, 2021.
Last 2 years, yes.
All right, okay.
So we had 2 solid years.
Yes, okay.
A process that is supposed to procure tablets.
Yes, so electronic tablets.
So that people at the district level can supply.
It's just not happening. And you're concerned about bureaucracy.
The bureaucracy is too much.
All right, so I have a young child, just about 1 year old, and probably he might be watching Daddy. But you know what, while I sit here, I'm very concerned. Because I'm concerned about measles, I'm concerned about polio, but you are equally concerned about tuberculosis.
Oh, yes.
And you say your institution is totally concerned. Share with me. I mean, why tuberculosis? And why should everybody be worried?
Look, it will interest you to know that globally, more than 1.5 million people die a year of TB. In this country, Ghana, we have more than 15,000 people dying every year of TB. Meanwhile, the disease has a cure, and treatment of it is even free. But for Ghana to ensure that we have enough logistics, diagnostic systems across the country, resources that will ensure that the same supplies are available. Because if you even have the few diagnostic machines that we have, we call the gene expert in the country. If you need sputum containers, you need cartridges that they use to fix in these machines before the diagnoses are done. You will be surprised sometimes for a whole month, for 2 weeks, for 3 weeks, for 3 months, you have shortage of supply. Why? Because the supply chain management system is not being effective. There are human beings that are responsible for this. Sometimes they will tell you it is money.
Yes, the minister has mentioned that it is money. Let me make this snappy by finding out from you. So you have been to Wawale, you have been to Bolga, you have equally been to the western region and probably some parts of the central region. You're monitoring the situation on the ground, and you know that, the logistics we need for TB is just not available. If you have to address the Minister of Health or the duty bearers, in short, what would you want to tell them?
See, it's important. When you take, for example, tuberculosis, TB, HIV and malaria in Ghana, the Global Fund provides so much resources. But before Global Fund will give you all those resources, they expect government to do what we call a counterpart funding. And it is the same challenge that the Gavi is facing. If the government is not able to provide its parts, the donors are not able to provide the full dose of things you need to curb your situation in your country. And so it is important for the minister to ensure that the government, the president should get interested in these things. and Parliament should allocate resources for TB control. It is just important. As we speak, it's so deadly. We are having the upsurge of multi-drug resistant TB, but there are times there are shortages of all this, and then the system is locked.
You mentioned Parliament, so what? Your call is to Parliament also?
Of course, it's Parliament that approves budget. So the question is, the diseases that are killing people in this country, how much budget are you allocating to them?
But your organization is probably sleeping. What have you done? What have you done around this?
Of course.
Advocacy, what have you done? Apart from me giving you the platform here on GHone TV, what have you done?
It will interest you to know that we always even on the head of the minister. Every time you are, sometimes they are also so busy you can't even meet them. But I tell you, all the time we are on the head of the duty bearers. We are part of the national TV program. Civil society is playing its role so seriously at the grassroots. And it will interest you to know that we have almost 100 civil society organizations across this country who are running from village to village, hard to reach communities, to ensure that they collect sputum of people who are suspected of TB, transporting them to the laboratories, and getting those who are screened positive, those who are diagnosed positive, onto treatment, providing treatment support services for them to be able to ensure that they are cured of TB. And so civil society is not asleep. What we need is the president of Ghana, who went to New York in 2018 to sign on to the United Nations high-level meeting on TB targets, to make sure that he ensures he gets so much resources to fulfill the target. Indeed, we are expecting that this year, on 23rd of September this year, we are expecting him to get back to New York. We are all going to be there. We want him to come and give account to us on, since 2018 he came back to Ghana, how much resources is allocated to ensure that the disease burden of TB on this country that has been given him, even at the United Nations level, this is how much he has achieved.
And that is to the president.
That is to the president. He must. It is critically important.
Kwesi Afreh, thank you very much. I mean, I'm sure. I thought you were taking it to the finance minister, but this time you've moved to the president.
The president will get interested.
Absolutely.
Children are dying of TB, and the first lady needs to get interested.
It's a concern for the nation, and I'm sure television gets results once you've channeled it through GH1 TV. We will be getting some.